This is the most important step of the IVF, where you do the embryo transfer, and this is an ultrasound guided embryo transfer. And as you can see, the bladder is full, which is making the angle of the uterus easily accessible. And you can see behind the uterus the enlarged ovaries. And you start by cleaning the cervix, and hopefully you have done the mock ET during egg collection. We'll start by gently negotiating the cervix, and after inserting the speculum, you'll start inserting, as you can see, the start of the insertion of the cannula or the transfer catheter very easily, and you very gently manipulate until you pass the external os and the internal os. And once you insert the outer sheath, then you very gently insert the inner sheath after loading it with the embryos, after of course doing all the checks with the embryologist, and making sure that this is the right patient, of course. And then once you have reached the maximum implantation point, as you can see here where the endometrium is very thick, you very gently insert the inner sheath and advance it to the point, and usually it's 1.5 millimeter from the fundus, which is to 2.5, and you start adjusting the insertion point and advance it. And as you can see here, the embryo was inserted, and then the transfer catheter was very gently withdrawn after that. It's a routine practice to check the catheters to make sure that it's clear and the embryo has left the transfer catheter. And as you can see, the bright spots in the middle of the endometrium are the fluid containing the embryos. Try to avoid in the embryo transfer any bleeding, and make sure that she's not in much pain to avoid any contraction of the uterus.